Welcome to Innovators, a series where we sit down with thought leaders across the healthcare space to discuss some of the industry's most pressing topics. Joining me today is Sudha Sureddi, VP of Product Management at Brightree, and we're going to talk about infusing automation and AI into cross-functional workflows. Thanks for being here today, Sudha.
Thank you. Thank you for having me here today.
So we know that automation and AI are everywhere in healthcare right now, from scheduling to clinical documentation to rev cycle, and you've spoken about smart connections across care, staffing, and revenue. What's driving the urgency for automation in post-acute and home care settings today?
That's a very good question. With reduced reimbursement cost and increased cost to manage the workforce and the reduced availability of quality healthcare providers, it has become increasingly necessary for these organizations to focus on reducing costs and maintaining the same quality of care. That's where AI and automation comes into place, where all these organizations, our customers, are looking at us mainly to help them reduce their cost with automating and through AI reducing the manual tasks and focus more on empathy and care of patients, and where more coordination is required from humans and reduce the manual intervention.
How are you able to evaluate where the automation should really be implemented versus what's better left in human hands?
Yeah, very good question. So if you look at a workflow or any process that involves patient care or revenue cycle or any other mechanism in a healthcare setting, there are certain manual and repeated tasks that do not require a lot of context or a lot of decision making from a human perspective. These are repeated tasks that you can automate with minimal oversight. These are the ones that we absolutely want to start automating and making sure that we provide the decision making in the hands of the users, in the hands of the providers, so they're able to do the right decision making and provide the right outcomes for the patients.
And product leaders, as you know, are often challenged to prove ROI while managing implementation risk and change fatigue. What criteria do you use to weigh the short-term efficiency gains against long-term outcomes like adoption and satisfaction?
Absolutely. One of the biggest hurdles that we see in any implementation of AI or non-AI platforms is adoption. And we are trying to overcome some of these with reducing visual shock for our users. So our users have been using platforms and, like any other application, have been familiar with a certain flow and certain screen. So we are trying to reduce the visual shock by not introducing a lot of new screens, not disrupting their workflow. So we are trying to compress the amount of steps that they need to take so that they are doing something faster and getting to the outcome faster. So definitely implementation and the thought process around more innovative implementation is a factor. Training is a huge thing. So it's not like learn as you go phenomena, but more intuitive training on how does the workflow change or does not change from this automation. ROI definitely has been a very interesting factor to calculate. There are tangible ROI that you can calculate in the sense of cost reduction, improved quality, faster outcomes, faster retrieval of documents and such. But there are certain intangible ROIs that we are able to quantify in the sense of employee delight, which is very difficult to get these days, in the sense of how excited they are to use our new products, how efficient they feel when they're using our product and innovations, and the employee retention that they're able to have, and the minimum onboarding and training that they need in these kind of platforms. So we as product leaders are thinking more on the tangible and the intangible ROIs that we are able to articulate, and definitely short term would be how soon can these platforms be adopted, to long term where there is repeated success, which shows in the financials of the organizations as well.
Going back to the empathy piece you mentioned earlier, we know that it's critical to maintain the human element in healthcare, and as automation and AI streamline some of these repetitive tasks, how do we ensure that we're enhancing the clinician and patient experience without eroding the empathy that really does define quality care?
Yeah, absolutely. So there was a recent study by Harvard which demonstrated that 95% of AI-based products in healthcare fail mainly because do not automate or do not build AI products for the sake of AI and automation. I think the success relies more when user is in the center of the innovation, when user has the control to understand how the process works and how the outcome needs to be, and they are in the center of decision making, and they are able to pass through or they're able to accelerate care for the patient. So you would see that in the industry and in general, you would see a lot of success when user definitely is in center of loop for all of these AI innovations, because it's easier and faster for them to relate to the process, relate to the innovation, and have a meaningful outcome from there.
Can you give me an example or two of where these kind of smarter workflow automations improved not only the operations, but they did have that measurable impact on the people, the patient, clinician, staff morale?
Yeah, absolutely. So very recently, we've launched an AI-based product within our own organization where we are trying to compress the order-to-cash time. Typically, what would take you multiple days or possibly hours of activity, we have compressed that into a matter of minutes. What happens here is there is accelerated response to patient care. So instead of patient trying to wait for care for a certain number of days, the customers are now able to respond back immediately on what the next steps are in the workflow or the next processes are, or go ahead with scheduling or go ahead with fulfillment. So it has brought tremendous improvement in the way customers perceive patient care. Instead of trying to do a ton of manual paperwork, we have accelerated the process. It's been a very engaging and very learning experience for us delivering the solution.
And, it's no small feat to kind of implement and infuse these technologies throughout an organization. What are some lessons learned from scaling automation across a complex organization, especially when balancing standardization with the unique needs of individual teams or care settings?
Absolutely. So I think the biggest lesson that we have learned in trying to deliver this successful product was we were obsessed with the customer problem. So instead of trying to focus on a solution first approach, it was what is the customer problem and what is the spectrum of customer problem that we are trying to solve. So every different customer would have a different workflow or a different scenario, unique circumstances that they would be working through. So we kind of tried to build more generalized solution that would work for the general customer base, and then have AI bridge some of those gaps where a specific automation or customization would have been required. So that's how we address that.
And as we close today, let's look ahead. Where do you see the next wave of AI-driven innovation really having the greatest impact in healthcare workflows? And how do you think that leaders could prepare their teams to adapt effectively?
Yeah, I think we are just getting started with AI in healthcare. It's very promising, and I think as we focus on solving more customer problems, AI would bridge a lot of gap in the workforce, in the training, and making sure that the repeated tasks and manual tasks could be more intelligently automated, leaving the empathy and leaving more time for providers to focus more on patient care. A very good question that you asked on the adoption and implementation in the organization. AI definitely needs some kind of learning across different organization levels, I would say. You would have teams that are probably a bit more advanced, a bit more knowledgeable about AI. I think as you want to think about adoption of AI into the platform, you want to bring your entire organization together. So I would recommend organization definitely invest in learning and training of what AI is and remove any misconceptions on what it can and cannot deliver. I think that's a huge hurdle that we have to overcome. The second thing is definitely having regulated and governance build on what AI should and should not do in the organization. That's one of the critical factors that as we go, we are learning. We have new regulations coming externally as well on what AI can and cannot manipulate as well. And I think definitely having a lens on adoption and the training of the models on how we are building more accurate models as we progress, and how much ROI value it's creating and constantly evaluating your systems, constantly learning from them and making it better will take us a long way.
So the lesson here is that yes, AI it's kind of new and evolving, but it is something that everybody should be leaning into.
Absolutely. I think the tools and technologies are here to help mankind, and I think as leaders and thought leaders in the industry, we should focus on how some of these can help better mankind, I would say. And our means is to solve some of these problems for our customers, providers, and such. So the focus remains entirely on patient care.
Absolutely. I love it. That's a great way to end the conversation. And Sudha, I really do appreciate you being here today and for the continued partnership, of course.
Thank you so much. Thanks for having me here today.
Of course. And to our audience, thank you so much for watching. Be sure to keep an eye out for our next episode of INOvators.